Hey, how's everyone doing? It's Thursday, August 20th. I wanted to talk about a couple things. Last week the unemployment numbers were down under a million, but guess what? They're back up, and this week's or last week's numbers were 1.106 million people filed easy for me to say, first time claims for unemployment. Over a million again. We did have that one week, it was 963,000 or something, but 22, 23 weeks now of over 1 million people filing for unemployment, first time. Obviously, things are not getting better. You hear a lot of the excitement about the stock market making new highs and getting up there again, and about this V-shaped recovery. There is no V-shape. If we're having a V-shaped recovery, you have this V, you have this down thing, and then you'd have an up thing. We have no up. We have only sideways. It's really just going sideways. There's really nothing happening. Things are getting worse. More and more companies are laying people off. So don't really believe what you're hearing in the media, because they're really not giving you the truth. I was kind of a couple other things I want to talk about, but there's one I really wanted to sort of cover, and because we hear it kind of relates to the unemployment thing. We hear a lot about things will get better when we have a vaccine, and so I wanted to kind of give a little background of how this vaccine thing works, and how we've had vaccines around for many, many years, and we still don't have complete cures for other diseases, and that we get immunities from them. So give it a little background. In 1940, Thomas Francis and Jonas Salk, they were the lead researchers at the University of Michigan to develop the first inactivated flu vaccine with support from the U.S. Army. Their vaccine uses fertilized chicken eggs, which is pretty much still one of the main methods now for creating vaccines. The Army is involved with the research because their experience with troop loss from the flu illness and deaths during World War One. The original vaccine only includes inactivated influenza A virus, didn't include the B. So skipping forward a little bit, 1945 was the year that an inactivated influenza vaccine was licensed to use in civilians. So that was the first time that a flu vaccine was actually administered to the normal public. In 1942, a little bit before that, the CDC Center opens, and that's when they first started. In 1947, during the seasonal flu pandemic of 47, investigators determined that changes in the antigenic composition of circulating influenza viruses has rendered existing vaccines ineffective. What that means is that the viruses mutate, and they change a little bit so that the vaccine that was created for this particular virus doesn't work on the next virus, or the one that's mutated a little bit, and so that vaccine doesn't work any longer. In 1948, the World Health Organization, WHO, was established. And the interesting thing is, the primary task of the organization are to collect and characterize influenza viruses, develop methods for the laboratory diagnosis and influenza infections. That was what they were supposed to do. That was their charter, was to go out and figure out and know everything about influenza and how influenza affects us, and and maybe how we get it, and what we can do about it. In 1957, a new H2N2 flu virus emerged, and to trigger a pandemic. There were about 1.1 million deaths globally, and about 116,000 in the U.S. Excuse me. No lockdown. There was no lockdown during 57 influenza pandemic. In 1960, the U.S. Surgeon General, in response to substantial morbidity and mortality during the 57-58 pandemic, recommends that annual influenza vaccines or vaccination for people with chronic debilitating diseases, people aged 65 or older, and pregnant women. Sounds pretty familiar, doesn't it? That it was even back then, they knew that the flu would affect a lot of people who were older or had other underlying causes not underlying causes, underlying illnesses that would affect or make them more susceptible to the flu. In 1966, the FDA licensed amantadine, a new antiviral medication, as a prophylactic, which is preventative medicine, against influenza A, but it wasn't effective against B. And then in 1967, Dr. Pereira, the colleagues proposed a relationship between the human and avian flu. So it was back in 67 that they started thinking that there was something to do with, there was some relationship between human flu and avian flu, or bird flu. And then in 1968, a new H3N2 influenza virus emerges to trigger another pandemic, resulting in roughly 100,000 deaths in the U.S. and 1 million worldwide. Most of those deaths are in people of 65 and older, and H3N2 viruses circulating today are the descendants of the H3N2 virus that emerged in 1968. So that's how they mutate, but it's still the same virus over and over. It just mutates a little bit every year and makes it, that's why I said the vaccines don't work. Or they don't work as effectively as they want to sell them and make you think they work as effectively. An H1N1 swine flu outbreak results among recruits at Fort Dix leads to the vaccination program to prevent a pandemic. Within 10 months, roughly 25% of the U.S. population is vaccinated, 48 million people approximately, about twice the level needed to provide coverage for the at-risk population. Unfortunately, cases of Guillain-Barré syndrome, a neurologic condition that in rare instances has been associated with vaccination, among vaccine recipients appeared to be in excess of what was expected. So officials determined that the vaccine program should be halted. So they knew that some people would get this syndrome, but that was part of the risk. Unfortunately, it sounds like at that time, the number of cases of that particular syndrome were greater than what they expected, so they didn't want to continue doing the vaccination because it might increase the number of people having this syndrome, which was obviously something pretty bad because they didn't want you to, they stopped vaccinating people because they didn't want you to get it. So then, skip forward to 1996, an avian influenza H5N1 virus is the first isolated from a farm goose in China. So does it sound familiar? Something came from, it was from a bird in China. In 1997, the first human infection with avian influenza A, H5N1 virus, is identified in Hong Kong. Interesting that how many of these things come out of the East. In 1998, influenza virus surveillance in swine conducted by the U.S. Department of Agriculture begins in the United States. A virus that is a hybrid of the human-bird swine flu viruses is detected in pigs, and the virus becomes dominant flu virus in pigs by 1999. Remember, that was called the swine flu. In 1999, the pandemic planning framework is published by WHO, emphasizing the need to enhance influenza surveillance, vaccine production and distribution, antiviral drugs, influenza research, and emergency preparedness. So back in 99, the WHO was already putting out their guidelines for what they thought should be happening. Now, I don't know whether all these things did happen or not, but obviously there was some guidelines that they knew about how to enhance influenza surveillance. So that was that kind of like maybe the beginning of, what do they call that? The contact tracing. In 1999, there was a neuraminidase inhibitors. Tamiflu was licensed to treat influenza infection, and that one's still around. In 2003, public health officials are concerned about the reemergence of H5N1 avian flu influenza reported in China and Vietnam. And in 2005, the U.S. government national strategy for pandemic influenza is published. I'd like to see that. I'll have to go look that up, see what the government national strategy is, because if it's locking people down or something like that, then we'll know where they probably got that. It was interesting, though, that it wasn't until 2005 that the entire genome of the 1918 1918, H1N1 pandemic influenza was sequenced. That was the first time they. I mean, it took all those years to sequence that DNA. I don't know. I don't know enough about it. I'm still researching it. In 2006, now remember how many years we've been working on influenza stuff. There was a national strategy for pandemic influenza implementation plan is published. That document outlines U.S. preparedness and response to prevent the spread of pandemic. There's another one I want to go look up because I want to understand. I want to see what it is. If that plan says to do what they're doing now, which is locking people down. In 2007, they improved the first vaccine for people against the avian influenza H5N1 virus. And then in 2007, also a human infection with a novel influenza virus, which is what we had here with the cornholio virus, I'll call it, because I won't say the other one because YouTube bans you if you do that. It was interesting that they said with a novel influenza virus is added to the nationally notifiable disease list. So if you have it, I guess you get nationally notified or somebody's notified that you have this, and that's probably what we're seeing today. In 2008, the Health and Human Services Pandemic Influenza Operational Plan is published. There's another one. They got all these plans, and you don't know what they say, so I have to go find out what those really are and see how they relate to what they're doing today. And then finally, one of the last ones is in 2009, the new H1N1 virus is detected in the U.S. The CDC begins working to develop a virus called a candidate vaccine virus that could be used to make a vaccine to protect against the new virus. Again, this is 2009. There is no vaccine for flu. All they do is give you the shot of the previous years, hoping that maybe the one that we get the next year hasn't mutated too much to make the vaccine ineffective. It might be semi-effective, but they don't want it to be totally ineffective. 2011, WHO officially declares the new 2009 H1N1 outbreak a pandemic. There wasn't any lockdowns during 2009. None that we know of. I mean, I was around in 2009. I don't remember being locked in my house for 6 months at a time, or can't go to work, or closing your business down. And then in 2009, the first doses of monovalent H1N1 pandemic vaccines are administered. So it's interesting, though, in 2017, the CDC updated guidelines for use of non-pharmaceutical measures to help prevent spread of pandemic influenza based on the latest scientific evidence. Follow the science. There are actions that involve individuals, communities to take to slow the spread of flu, like staying home when sick, covering a cough or sneeze, and frequently washing hands, or wearing a face diaper, which probably adds on to that. So it's interesting to see how many years back in the 40s when they started working on influenza vaccines, and we still don't have one. So I would say I'm not going to put a whole lot of faith in whatever vaccine they're creating. I don't think that's going to necessarily solve our problem. I think we're just going to be like all the other flu vaccines. They might have one for this year's cornholio virus, but next year it might be different, and the vaccine may not do anything. So think about when you hear about the need for a vaccine and how things will be better when we have a vaccine. I don't believe there will be a vaccine. I don't believe there'll be a vaccine effective enough to totally eliminate this, but we'll see. I'm going to do some more research on some of those plans that they have and try to find out a little bit more about those and see how those relate to what we're doing today. But that's it for today. Some of the things I want to talk about, but I went a little long on this one, so I want to thank everyone who watched and you stayed to the end. If you would consider it, maybe subscribe and press the little bell so maybe I can get moved up a little bit and more people can see what I have to say. But otherwise, love you all and hope you have a great weekend. It's coming up, and we'll talk to you later. See ya.